Reports today that his father, Joe Jackson, is on his deathbed. The 89-year-old was hospitalized Friday in Las Vegas with cancer. Sources say he's been battling the illness for some time, but according to TMZ, doctors have told the family it's terminal and Joe doesn't have long to live. Jackson reportedly issued a somber tweet that reads, "I have seen more sunsets than I have left to see. The sun rises when the time comes, and whether you like it or not, the sun sets when the time comes." But his granddaughter, Paris Jackson, says he did not tweet those words. Joining us now is Dr. Danish Ali with UTMB Galveston. We want to welcome you to the Factor Uncensored. Is this illness, pancreatic cancer, typically fatal?
It is, yeah. It's one of the most common causes that folks that have cancer, they die from at a very young and early onset of the disease itself. And the reason for that is because pancreas is one of the smallest organs, and what happens is that by the time that it progresses in its symptoms, it's already metastasized. And so once something, especially a cancer, metastasizes to other parts of the organs, other parts of the body, it's often fatal, and folks typically die very soon. There's different stages of cancer as well. In his case, from what I've been able to read about, it's stage 4, meaning that it has metastasized to the other organs and includes lymph nodes as well. And so the average median lifespan is approximately anywhere from 1 to 5 months.
And you brought us a list here that we're going to take a look at, Dr. Ali. If we can put that up and show the people pancreatic cancer symptoms that are out there that we could be aware of?
Sure, yeah. So the symptoms, as on the screen, are the nausea and vomiting, weight loss, and jaundice. The bile ducts that secrete fluids get obstructed, and so you can get jaundice, you get right upper quadrant abdominal pain, and sometimes that radiates into the back as well. And sometimes folks present with diabetes as one of their symptoms. Their glucose is not being managed, and the reason is because insulin that is produced by the pancreas, because of the tumor itself, is not being able to be produced, and so folks come in with diabetes as one of their complaints. But again, that's very rare. The most common symptoms are the nausea, vomiting, jaundice, and weight loss, as I mentioned earlier.
Any
risk factors?
Yeah, risky behavior that we may have that would cause it.
Yeah, there are a few. Smoking is definitely one of the most common ones, as well as family history as well. Folks that have a family that has had pancreatic cancer or other sorts of cancers, specifically breast cancer. There are mutations, BRCA1 and BRCA2. Those mutations often also give you a higher risk to have pancreatic cancer. Age and ethnicity. Generally, the older you are, the more likely you are to get cancer. Ethnicity. African Americans are at a higher risk to develop pancreatic cancer in men, and so, specifically. Genetics, as I mentioned earlier, and obesity is another risk factor.
All right, Dr. Danish Ali, we want to thank you for coming on the Factor Uncensored, and we want to wish Mr. Jackson well.